You cut yourself, you can't stop the bleeding, or you have a nagging pain that just won't go away.
Should you go to the ER, or can you get help somewhere else? Health Watch reporter Beth Galvin is here now to break it down for us. And Beth, this is an issue many of us struggle with, especially with kids.
It is, Mark and Gavir, and this is going to be a huge weekend. ERs are going to be swamped because you've got all the people who are out on the road, you've got everybody outside, you've got people setting off fireworks, cooking out. So if you get hurt or you get seriously ill, where are you supposed to go? Well, you actually may have more options than you think.
Mr. Michael McKinnon, correct? Right. Dr. Rodon, nice to meet you.
When Michael McCannon injured his thumb installing a door frame recently,
I cut myself with a saw, little back saw.
he didn't want to wait around to get it fixed.
He needed a couple of stitches. He needed the wound to be cleaned. He needed 2 stitches to close the wound.
So in less than an hour, North Atlanta urgent care physician Rodon had Michael cleaned up, stitched up, and ready to go. No long wait time, no big bill.
Walk in and get an insurance card, give her $35, and come in here, and that's it.
When you're sick or in pain, you want help quickly. But do you need to go to the hospital, or can you go to an urgent care clinic? Dr. Rodon, who's a board-certified ER physician who also works at a local ER, says a lot of people don't know the difference, so they end up in the wrong place.
Usually 60–70% of patients that go to the emergency room, they have an urgent care problem, something that we can take care of here pretty easy.
A good rule of thumb, if the problem appears life-threatening, go to the ER. Atlanta medical emergency physician Jason Carmichael says if you suddenly find yourself unable to perform basic tasks like walking or talking or lifting your arms, that's an emergency. A nagging or persistent pain that you've been tolerating for days is probably not. But experts say always head to the ER for critical warning signs like chest pain, stroke symptoms like weakness and slurred speech, abdominal pain, difficulty breathing, and go to the ER for a head injury or a major wound or burn. On the other hand, if you are not seriously ill or injured, prepare to get in line because ERs tend to be much more crowded than urgent care centers.
Compared to the emergency room, we're looking into 30–45 minute waiting time here in the urgent care compared to 3, 4, sometimes 6, 7 hours in the waiting room.
And then there's the cost. A basic ER visit starts at about $250. At North Atlanta Urgent Care, Michael paid $35, his part of the insurance bill.
Co-pays and deductible are a lot less in the urgent care compared to the ER.
If your problem is not life-threatening, urgent care is probably your best bet. They can handle everything from sprains and strains to minor bone fractures, mild asthma attacks, and cuts and burns. The bottom line, if you have any of the critical warning signs, get to the hospital. If not, you have another option that may save you some time and money. And just a reminder, the emergency room is not first come, first serve. A triage nurse will screen everybody coming in, and people with life or limb threatening problems are always going to go to the front of the line. So if you have a broken finger, you may have to wait while the staff treats somebody with, say, a ruptured spleen. Mark and Gavir. You know, it just depends on your level of emergency.
Yeah, can your insurance company help you, or your HMO, when it comes time to decide where to go in terms of getting treatment?
A lot of these companies have nurse helplines, so you can call and talk to a nurse about your symptoms, and she or he can help you decide which is the best option for you to go to. Often your urgent care copay is going to be a lot less than your ER copay, so that may make a difference if you have a small emergency.
So if you end up having to go to the ER, what should you bring with you?
A couple of things you want to bring with you. You want to bring all your insurance information. You also want to make a list of the medications that you're taking and bring that with you. If you don't have time to do that, throw the medications in a little plastic bag and bring them with you. Then when you get there, tell the triage nurse if you have any allergies or any medical conditions other than what's going on that they may need to know about, because that may factor in.
Yeah. Well, going to the ER or the urgent care can be intimidating. What's your best piece of advice for folks?
A couple of things. I think you should be specific and you should be direct. Instead of just saying, I've got stomach pain, say, I've got pain, you know, in this area. It gets worse when I do this. The more information that you can get the doctor, the easier it's going to be. The doctor is not going to want to play 20 questions with you to try to figure out what's going on. Help the doctor and the staff anytime you can.
Yeah, help them help you.
Yes.
Which is, you know.
And then you can get out of there quicker.
Exactly. Thank you, Beth.
Sure.
Appreciate it.